guys, it's your girl Ariza, a licensed clinical social worker with over a decade of experience helping people just like you pass the LMSW and LCSW exam. I've coached dozens of people to success, and now I'm here to help you do the same thing. So whether you're a first timer or a repeat test taker, this is the place to get the tools, the strategies, and the mindset that you need to level up and pass this exam. So let's jump into it. Today we're going to be talking about one of my favorite topics, and that is psychotic disorders. Don't think I'm weird, but I love psychotic disorders. This is one of my favorite in the DSM-5. Of course, there are a lot, but it's something about these disorders that kind of excite me. So I want to kind of go into it a little bit more depth. Now, remember, my trainings are like 15 minutes or less. So if you can't sit in here for 15 minutes and listen to it, and you're just not ready to sit for 4 hours for an exam, that's just what I'm going to say and what I'm going to tell you. All right, I'm going to go as quickly as I can, but I want to be efficient, and I want to make sure you get the information and the content you need to be successful. So let's jump right in. By the end of this course, this is a mini course, training, YouTube, whatever you want to call it. By the end of this video, you're going to be able to identify the 5 key psychotic disorders in the DSM-5. You're also going to be able to understand the symptoms and the diagnostic criteria of those 5. And I'm also going to highlight some treatment basics and some practical applications when you're dealing with clients with these specific disorders. All right, so let's jump into it. What are psychotic disorders? Psychotic disorders are, severe in nature, and the prognosis normally isn't great. They normally cause individuals that have distorted thinking, distorted perception, as well as their emotions and behavior just a little different, awkward, they don't align. A lot of times with people who have psychotic disorders, they experience delusions. Do you know what delusions are? Well, I break it down for you really quickly and easily. So a delusion is basically a belief of something that doesn't exist. There's no proof to show that that actually happens, but this person truly believes it. So it's something to deal with the cognition and the thought process. And then you have hallucinations. Hallucinations, I normally break them down and say there's 5 senses. So when I teach this to my supervisees, I want them to understand that you have the auditory. I can hear, they hear things that are not there. They also have the visual, they're seeing things that are not there. Tactile, they're feeling things that are not there. Sometimes they'll say things as they have spiders or bugs crawling on them, and they get all worked up. Those are all hallucinations. Then you have the olfactory, that is the smell. They're smelling things that are not there and that no one else around them can smell. I like to think of olfactory. I like to think of an olfactory that has a smell. So that's how I get people to memorize that specific hallucination. And then last but not least, let's see. We said the hearing, we said the visual, we said the feeling, we said the smelling, taste. That is gustatory. That is the gustatory hallucination. So there we go. We got all 5 of them. Make sure you align them with your senses. The test is not going to ask you anything specifically like, is John experiencing a gustatory or tactile hallucination? No, it's not. But it's good to know as a mental health professional and as a licensed clinician, these are just things that you just want to know that but enhances your knowledge and your skill set in your career. All right. They also have some disorganized thinking. So they might be saying things and doing things where the thought process is just a little off. Maybe it's Wednesday and they feel Wednesday and it's the summertime and they believe it's the wintertime and it's April. I don't know. They're disorganized in their thought process. Abnormal motor behavior. So you'll see some abnormality in their motor and their functioning. And then you have the negative symptoms. So this is like the alogia and the word salads and the slurring of the speech and fixing and changing words and all those types of things. Those are some of the negative symptoms that you will see with someone with psychotic disorders. All right, so let's move on and let's break it down to the big 5. Yes, the big 5. Not to confuse them with the 5 hallucinations that I shared with you, but the 5 types of psychotic disorders you're likely to see on the exam. And I'm going to break them down. So first and foremost, you have schizophrenia. Schizophrenia, you're normally looking at active symptoms, both positive and negative symptoms, and some cognitive decline. They're not really all there mentally in their thought process. And this is normally someone has to have these symptoms for at least 6 months or more. And then they have to have 1 month where these symptoms are pretty active. So you want to remember that when this comes to schizophrenia, normally that is the worst prognosis because it's long term, and that means this person has been experiencing this for at least 6 months. So it's pretty kind of definitive that this is their diagnosis. But before we get there, the person can have schizophreniform disorder. This is similar to schizophrenia, but it's a shorter duration. So with schizophreniform, you have the duration anywhere between 1 month and 6. So if the person starts having symptoms for 2 to 3 months, that is schizophreniform. But if it hits that 6-month time frame and up, then they have full-fledged schizophrenia. Symptoms are very similar though. So the key characteristics, you want to look at them. They're all similar. They just have a different duration in time. That is why I'm showing you this beautiful chart. That if I was you, I'd take a picture of it. Unless you're in the course and you'll have it anyway. All right, brief psychotic disorder. It's a sudden onset of symptoms, often stress related. So you have this psychosis that's going on with this person. It's a quick onset and is normally as a result of stress. And normally it only lasts a day to about a month. So pretty much after 30 days, you don't really see these symptoms. But if you do, what's going on? You got it. That person has schizophreniform. And if after 5 to 6 months, 6 months go and they still have it, they got what? Schizophrenia. You guys are smart as hell. All right, delusional disorder. This disorder, they have non-bizarre delusions without other psychotic symptoms. So they don't have the other psychotic symptoms that you see with schizophrenia, schizophreniform, brief psychotic, but they have these bizarre delusions, and that is the delusion disorder. The duration varies in this disorder. And schizoaffective disorder, I like to look at that as schizophrenia's cousin because pretty much the symptoms are the same except you have that mood. So it's the moody cousin of schizophrenia. The mood episodes do normally accompany psychosis. That is what makes a difference. Psychosis does not take place without the mood. But for it to be diagnosed with schizoaffective disorder, the psychosis has to be independent for about 2 weeks, 2 weeks or more. You see the little sign, threw me off a little bit. But with schizoaffective disorder, this is how it is to break it down. So you have someone that might be experiencing some mood instability. They might be depressed, they might be sad, but then they're also having this psychosis where they're experiencing some of the hallucinations, some of the delusional thoughts. These are the things that they're experiencing along with that sadness. And then the psychosis is a little bit more independent. So I want you to keep that in mind because a lot of people get this confused with another diagnosis, and I'll break it down a little bit further in this presentation. So some differential diagnosis key questions that you want to ask yourself when you're trying to diagnose someone with a psychotic disorder is one, is it substance induced? Does this person use a drug or a substance and maybe they're hallucinating as a result of this and it's not really a psychotic diagnosis? That is what you need to ask yourself. Could it be medical condition? Because a lot of times with medical conditions, you have all types of side effects. And then if you take medication, some of those side effects can be induced. So you want to ask yourself these questions to make sure you're not giving someone a diagnosis that is not appropriate or doesn't align with everything that's going on in their lives. Is it part of a mood disorder? So does this person have bipolar? Does this person have cyclothymia? Does this person have a major depressive disorder? Are they having something going on with their mood? And as a result, they're having some psychosis too that's underlining in and out of that mood disorder. So these are the questions you need to ask yourself. And it's important, as I shared in the other slide that I'm going to break it down for you, to understand the difference between schizoaffective disorder from bipolar disorder with psychotic features. I have a lot of my supervisees ask me this question and I just love it. Yes. So the way I explain it to you in simple form is that yes, someone can have bipolar where they have the up and down moods, they're dealing with mania or hypomania, and then they also are dealing with the delusions and the hallucinations and so forth. So you see those psychotic features. However, with schizoaffective disorder, those psychotic features are normally paramount. With bipolar disorder, the mood is normally paramount. So you have to think about it like this. If the person, say the individual John, is all over the place, he's just here and there. So he's kind of having a manic episode, but then you also notice that he's sad and down and he's dealing back and forth. But then he starts telling you how he was seeing things and hearing things and those type of things. That is showing some of the psychosis, but overall that mood instability is the most prevalent in his diagnosis. That is what is the setting the bar here. And then the psychotic features is just kind of something underlying. It's the same thing with schizoaffective disorder. The individual is experiencing, like someone has schizophrenia, so schizoaffective and schizophrenia, I told you they're cousins. So say someone with schizophrenia, but then they start having some fluctuation in their mood. They start having some of those sadness and some of those underlying mood issues. That is how you can distinguish that the person has schizoaffective versus bipolar disorder with psychotic features. Hopefully that was helpful. If not, you need me to break it down because it wasn't clear enough, hit me in the comment section. You know your girl will be right back, and I'll go ahead and update it and fix it or explain it to you in another way. So some cultural considerations. You always want to consider cultural things, because sometimes some diagnoses and some things that we look at as being weird or bizarre or trying to put a definition on it for the individual, it can be something that is related to that person's culture. So make sure you consider the cultural context of the person and the diagnosis that you're thinking about giving them. You want to look at the role of their culture in their delusions and hallucinations, because in some cultures, delusions and hallucinations can mean and look different. So you want to make sure that we're aware of that when we're looking at cultural. And then examples of cultural bound syndromes. So you want to be mindful of that, because in some cultures, there are some syndromes and some things that you'll see with those individuals in that culture that might be a little bit weird and bizarre to us, but it's normal to that person, that individual, that culture. Some cultures, they might take hallucinogens and things that kind of cause them to get loopy and be in a daze because it's a spiritual thing that they do within their culture. I don't know. I'm just throwing it out there, guys, but these are the things you need to be mindful of as a professional. You're going to see clients from all walks of life, so make sure that you take cultural things into consideration. Let's talk about the treatment real quick. Treatment options. You can take medications like that antipsychotics. Got a whole nother presentation on medication. So if you want to watch that, you can, and to teach you a little bit more about the antipsychotics. There's also different types of therapies. You have CBT for psychosis. You might also want to do some psychoeducation, educating the family on what to expect and what to look for and how to treat or how to care for someone that has these psychotic disorders. That is where the psychoeducational comes in. And then of course you have the holistic approaches where you have some lifestyle modifications. Sometimes diet can play a huge part in someone's mental health, and it can also make some improvements, help make some improvements and some changes there. And then also support systems. Maybe they need some type of peer support or some type of mental health coaching or peer connection, so that way other people who are dealing with similar diagnoses can give them insight on what they did to be effective and to kind of work through it. So these are some things that you want to be mindful of when you're looking at treatment basics. Now that I done said all that, and I need to take a little sip of my water here, I want to test your knowledge. So first question, what distinguishes schizoaffective disorder from bipolar disorder with psychotic features? Think about that. Number 2, name 2 features of brief psychotic disorder. And number 3, what's the minimum duration for a schizophrenia diagnosis? So think about this. We talked about it in the presentation in the slides. If you need to rewind and go back and look at it to answer those questions, please do so. But I don't want you to finish this mini training or presentation and move on to another video if you don't quite understand, you can't answer these questions. Before I move to the next slide, it's going to provide you the answers and I'm going to break it down. Please make sure you take a picture of this, write it down, and answer the questions or pause the video before moving forward. All right, now that we're back, let's talk about those answers. What distinguishes schizophrenia disorder from bipolar? Again, in schizoaffective disorder, psychotic symptoms occur independently for at least 2 weeks without any mood symptoms. Whereas in bipolar disorder, the psychotic features, like the psychosis, occurs exclusively during mood episodes. So while this person's mood is up and down, they're also dealing with some psychosis. But that mood is prevalent, guys. That is what I want you to understand and take from here. And the same thing with schizoaffective disorder. You are going to have the psychosis for about 2 weeks without any of that mood symptoms, but maybe you're working with a client and it's not during the 2 weeks. So you're talking to them on week 3. You want to be able to ask questions and understand that, yes, they were experiencing some psychotic symptoms before they start feeling down and saddened and things of that nature. Name 2 features of brief psychotic disorder. Sudden onset. We talked about that. Sudden onset of those psychotic symptoms, and remember, is from day 1 to month 1. So 1 to 1 is when you have that brief psychotic disorder. Anything over a month, you're moving into what? Schizophrenic form. You guys got it. All right. What's the minimum duration for schizophrenia diagnosis? I shared with you before, it has to persist for at least 6 months. And at least one of those months have to be active symptoms. So remember, we talked about the active symptoms. You can rewind the video to go back and see what those are. But that is pretty much how you would diagnose someone with schizophrenia and the minimum time frame to do so. So in summary, I want you to take away from this, because I told you I was going to keep this video short and sweet just to make sure you understand it, because I know how you guys' attention spans are, and we're right at the 15-minute mark, and I'm glad you stayed to the end. So remember, psychotic disorders are different based on the duration, symptom presentation, and the context. Remember, accurate diagnosing requires you to consider cultural factors, medical factors, and substance use. Remember, we had the differential sheet of the questions you ask yourself. And then last but not least, treatment normally involves medication, therapy, and support. Individuals that are dealing with psychotic disorders really need a lot of family support. So you as a professional need to have the ability to provide psychoeducation to these individual family members and their loved ones, so people can understand what to do, what to expect, and how to help this person maneuver through life with this disorder or with these various disorders. I hope this video was hella helpful. If you want more insight and you need more details, make sure you check out our course. Click it in the bio section. You'll be able to click on it and see and learn and look all into it and see whether it's going to be beneficial for you. I'm sure it's everything you need to pass and succeed. If you choose just to watch my videos and to be enlightened, please do so. Make sure you like, make sure you subscribe, and please make sure you share it with somebody else, because I want everybody to win, everybody to pass this exam, and everybody to just do the damn thing, so we can all walk around taking over the world with LCSW and LMSW on our chest. That is the plan, and that is what we're trying to get at. Be blessed until the next video. You have an amazing day, and I'll talk to you soon.